Hello everyone. Today, we're diving into the world of a medication called Ibrutinib, commonly known by its brand name, Imbruvica. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Ibrutinib, often recognized by its brand name Imbruvica, is an oral tablet that falls under the category of Bruton's tyrosine kinase (BTK) inhibitors. Its primary function is to interfere with the growth and spread of cancer cells. Initially approved by the FDA in 2013, Imbruvica is primarily prescribed for various types of blood cancers, including mantle cell lymphoma, MCL, chronic lymphocytic leukemia, CLL, small lymphocytic lymphoma, SLL, Waldenström's macroglobulinemia, WM, and chronic graft-versus-host disease, CGVHD. It works by targeting and inhibiting the BTK enzyme, which is crucial for the survival and proliferation of malignant B cells. By doing so, Imbruvica helps to slow the progression of these cancers and can induce remission in some cases. Warnings: Ibrutinib comes with its set of precautions. It's not intended for patients who are allergic to the drug or any of its components. There is a potential risk of serious infections, bleeding problems, heart rhythm problems, and high blood pressure. Patients should be monitored regularly for these conditions. It's also important to note that Ibrutinib can cause a decrease in blood cell counts, which may increase the risk of infections or bleeding. Before taking this medicine. Before starting Ibrutinib, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the immune system and blood cells, those with pre-existing conditions such as bleeding disorders, heart problems, liver problems, or infections should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Ibrutinib can harm an unborn baby, so effective contraception should be used during treatment and for at least 1 month after the last dose. You should not take Ibrutinib if you are on strong CYP3A inhibitors, as these can increase the risk of serious side effects. Inform your doctor if you are taking any medications that affect blood clotting, as Ibrutinib can increase the risk of bleeding. Before starting the medication, inform your doctor if you have ever had heart problems, liver problems, bleeding disorders, recent surgeries, or any other significant medical conditions. It's also essential to let your healthcare provider know if you have any symptoms of infection, as these should be treated before starting Ibrutinib. Side effects: all medications can have side effects, and Ibrutinib is no exception. Some individuals might experience common side effects such as diarrhea, muscle pain, joint pain, bruising, rash, and fatigue. More serious side effects can include bleeding, infections, high blood pressure, irregular heartbeat, atrial fibrillation, and decreased blood cell counts. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of more severe side effects such as liver problems, severe skin reactions, and tumor lysis syndrome, a condition caused by the rapid breakdown of cancer cells. Symptoms of serious liver problems include yellowing of the skin or eyes, dark urine, severe abdominal pain, and persistent nausea or vomiting. If you notice any signs of these conditions, seek medical attention immediately. Furthermore, Ibrutinib may cause serious side effects including high blood pressure, heart problems, and secondary cancers. It's crucial to have regular monitoring and to report any new or unusual symptoms to your healthcare provider promptly. Interactions: Ibrutinib might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Strong CYP3A inhibitors, in particular, should be avoided as they can increase the risk of side effects from Ibrutinib. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Ibrutinib. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Ibrutinib for most adults is 420 mg once daily for CLL/SLL, WM, and CGVHD, and 560 mg once daily for MCL. It's important to take Ibrutinib at the same time each day, with a glass of water, and to avoid consuming grapefruit or grapefruit juice as these can interfere with the medication. Avoid: while on Ibrutinib, it's advisable to avoid activities that could increase the risk of bleeding or injury. Given the potential for dizziness or fainting, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Ibrutinib. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Ibrutinib. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.